Morning. In case you don't know where you are, this is the House Committee on Health, and we welcome you, but this would be a good time to leave if you were looking for local government. We are really glad to have all of our members here, and we thank you, those that have come. We do know that we have some competition this morning in our meeting times. So the chairs did not resign. They just were called to serve in another capacity this morning. So thank you all for being here and holding down the fort. We have 3 bills on the agenda, but before we do that, I'd like to introduce our pages today. Edward Huang. And if you all will just stand up and kind of give a wave so everybody can see who you are. Caroline Lafon and Devin Toronto. Thank you all so much for being with us. We look forward to having you in the session this week, and we always love to have our pages observed. The Sergeant at Arms. And I always have to make my statement about the Sergeant at Arms. They make us feel safe, they make us feel organized, and they just do whatever we need for them to do, and they know what we need before we even need to, we know what we need. So thank you all so much for what you do for us. Terry McGraw, Nina Lage, Bill Riley, and Thomas Terry. Thank you all so very much for all you do for us. Okay, we are going to start with, I think on your agenda, if you brought your agenda, we're starting with 484, but we're going to actually start with 500 and let Representative Stevens go first because she has to run to another meeting as well. Representative Stevens.
Thank you, Madam Chair. Thank you, members of the committee. I guess probably 4 to 6 years ago, we started a group, the Child Wellbeing Transformation Council, and we were looking at things that would help things. One of the recommendations is what's here before you, and that is we found out that Medicaid with a child could not follow them into the classroom for counseling. So we have now, that's what this bill does, is direct that the Integrated Care for Kids Medicaid pilot program begin, which would provide development and implementation of a plan to increase awareness of the school-based health services that can be reimbursed by Medicaid, and then a follow-up study to be reported back to the, I believe it's Health and Human Services Oversight by March of 2027. And so I would ask for your support.
Representative Shepherd, you.
Madam Chair, I have a motion at the appropriate time.
It is the appropriate time.
I move for approval of House Bill 500, if favorable, with a referral to Rules Calendar, Operations of the House.
Representative Shepherd has a motion for favorable report to 500 with a serial referral to Rules Calendar and Operations of the House. All in favor?
Aye.
All opposed? I believe the motion has passed.
Thank you.
Thank you, Representative Stevens. Thank you, members. And next, we will have the Mental Health Confidential Information Disclosure, Bill 484, Representative Blackwell.
Thank you, Madam Chair. Currently in North Carolina, there are unique provisions that have been imposed in North Carolina over and above what is required under federal law that relates to disclosure of confidential information by mental health providers. This legislation basically would say that rather than adding additional requirements, we would simply go with the minimal requirements that the feds already imposed. Give you 2 examples of where we think the added state requirements that would be eliminated may be improved by their elimination. Currently, under North Carolina law, there's an automatic 1-year expiration date on all of these consents. That's not required under the federal legislation. Under the federal legislation, you can specify an expiration date, but it doesn't have to be 1 year. So this would save the patients and the providers from having to automatically get a new consent every year and from monitoring when the year was up. A second thing is that under North Carolina law, we currently say that we have to specify by name the individual or agency that can receive the information. That's not required under the federal law. Under the federal law, the authorization can identify the recipient by a class of persons such as my doctors, my nurses, my dermatologists, my mental health provider, and so forth. So we're simply trying to make the practice easier. It'll still protect confidentiality, but we'll just be governed by those federal regulations rather than layering additional state requirements on top. Glad to try to answer questions.
Are there any questions? Representative Cunningham.
Thank you, Madam Chair. Representative Blackwell, I'm very familiar with those documents, and you're saying we're going to alleviate having to do it annually, and we can put in, whoever the practitioner is can say, well, we wanted to do it in 2 years instead of doing it in 1 year.
Yes.
Thank you.
Yes.
Seeing no further questions, do we have a motion?
Madam Chair, I have one. I move for a favorable report to House Bill 484 with referral to rules.
Thank you, Representative Shepherd. All in favor? All opposed? Representative Shepherd has moved and is for a favorable report to House Bill 484 with the serial referral to rules, calendar, and operations of the House, and the body has approved. Thank you. Representative Crawford. Representative Crawford will be presenting House Bill 530, Advocacy for Bone Marrow Education and Registration.
Thank you, Madam Chair. Good morning, members. So today I am presenting House Bill 530, which enacts the LeCount Night Advocacy for Marrow Education and Registration Act, which would designate November as Marrow Donation Awareness Month and require some public service announcements. I want to tell you a little lobbied very passionately for our state employees for many years. He was diagnosed with leukemia and lost his 5-year battle in October of 2020, just 3 days shy of his 47th birthday. Every year, more than 44,000 Americans will be diagnosed with leukemia, and only 30% of those who need a bone marrow transplant will have a matching donor in their families. And what this bill does is it raises awareness about how to become a bone marrow donor, how to put yourself on the Be the Match registry, which gave Kevin LeCount 5 years more with his son and with his family that he would not have had without a bone marrow transplant. Obviously, he did lose his life to leukemia, but had he not had that bone marrow transplant, it would have ended sooner, and he would have missed out on precious time with his now teenage son. So I ask for your support for this legislation. It did pass out of this body a few years ago when it was first introduced by then Representative Yvonne Holley.
And I'll have a point of personal privilege. Thank you so much for introducing this bill again, Representative Crawford. This is a good bill. Do we have questions? Seeing no questions?
I don't
sorry,
have
I
a
thought you were
question.
hitting-
A
I thought you
motion
were
at the
shaking your head,
appropriate
yeah.
time, Madam Chair.
You have a motion, okay.
Yes, ma'am. I ask for a favorable report with the referral to rules and calendar operations of the House.
Representative Cunningham has moved for a favorable report for House Bill 530 with the serial referral to rules, calendar, and operations of the House. All in favor, say aye. Aye. Any opposed? None. Seeing none, House Bill 530 is approved and will be moved forward. Thank you. Do the other health chairs have any further business that they want to discuss today? If not, we are adjourned. And I would just like to put a point of personal privilege on your way up. And I would just like to put a point of personal privilege on your way up. And I would just like to put a point of personal privilege on your way up. And I would just like to put a point of personal privilege on your way up. And I would just like to put a point of personal privilege on your way up.